Assalamualaikum and hello everyone. In this video, I will explain the application of bronchoscopy and how physics plays an important role in this medical procedure. Bronchoscopy is a technique used by doctors to examine the airways and lungs using a device called a bronchoscope. This procedure helps in diagnosing diseases, removing blockage, and collecting tissue samples. What's made bronchoscopy interesting is that it depends heavily on physics, especially in wave optics, mechanics, and fluid dynamics.
A bronchoscope is a thin and flexible tube that is inserted through the nose and mouth and guided into the lungs. It is equipped with a light source and a camera, which allow doctors to clearly see the inside of the airways. In addition, it has a special channel that can be used for suction or to pass small surgical instruments. With these features, doctors are able to observe the respiratory system in real time and carry out procedures safely and accurately. The first important physics concept involved is wave optics, specifically fiber optics. Inside the bronchoscope, light is transmitted through optical fibers using a principle known as total internal reflection. Snell's law describes how light behaves when it moves from one material to another. This is the formula. When light travels from a denser medium to a less dense medium at a specific angle, it does not pass through. Instead, it is completely reflected back inside the fiber. This process allows light to travel over long distance without significant loss, and it enables clear image to be transmitted from deep inside the lungs to the camera. Without this principle, it will not be possible for doctors to see clearly inside the respiratory system during bronchoscopy. The second concept is mechanics, which involve force and motion. During bronchoscopy, doctors must carefully control the movement of the bronchoscope as it passes through narrow and curved airways. This can be explained by Newton's second law of motion. This is the equation. This equation shows that force is equal to mass multiplied by acceleration. In bronchoscopy, applying too much force can injure the delicate airways tissues, while applying too little force makes it difficult to move the scope forward. In addition, doctors must consider friction between the bronchoscope and airway walls, as this affects how smoothly the instrument can move. The third concept is fluid dynamics, especially when removing mucus or other fluids from the lungs. Bronchoscopes use suction based on pressure differences, which can be explained by Bernoulli's principle. This equation shows that when the velocity of a fluid increases, its pressure decreases. In bronchoscopy, a low pressure region is created inside the tube, causing fluids to move from a region of higher pressure in the lungs to a region of lower pressure inside the bronchoscope. This process allows doctors to safely remove substances such as mucus, blood, and foreign particles from the airways. Bronchoscopy is widely used in hospitals for several important purposes. It helps doctors diagnose lung infections, detect tumors or cancer, remove foreign objects, and take tissue samples for biopsy. All of these applications are made possible through the use of physics. Wave optics ensure that images inside the lungs are clear and visible. Mechanics allows precise and controlled movement of the bronchoscope through the airways. Fluid mechanics enables the safe removal of mucus, blood, and other substances. Together, these physics principles make bronchoscopy an effective and life-saving medical procedure. In conclusion, bronchoscopy is not only a medical procedure but also a powerful example of how physics is applied in real life. By combining wave optics, mechanics, and fluid mechanics, doctors are able to diagnose and treat patients with greater accuracy and safety. This clearly shows that physics is essential in advancing modern healthcare. Thank you for watching.